In a few hours, it will be 100 days since the coronavirus pandemic hit Kenya, when the first case was confirmed. During the 100 days, the testing strategy deployed has evolved from limited testing targeting asymptomatic travelers to now targeted mass testing in areas reporting increased infections. It's an expensive process whose high infection rates are synonymous with increased sample size. Sam Gituku reports on the state of testing in the country.
That the Ministry of Health has confirmed the first coronavirus case in Kenya.
That Friday morning dawned the reality of a global pandemic in Kenya, a country that had been in denial with no clear strategy to keep the virus away from its borders. And so it was literally learning on the job. The country had just acquired testing technologies for coronavirus, but limited capacity. That time, testing was limited to travelers, foreigners and Kenyans returning to the country and showing symptoms upon screening at the entry ports. For those that tested positive, they were immediately isolated and their contacts traced, required to self-isolate and report progress. And then self-quarantine was not effective, forcing the government to enforce mandatory quarantine at the cost of clients. Most of the travelers completed their quarantine without exhibiting symptoms. Testing at the time was targeted at those concluding their mandatory quarantine, and later the ministry started rolling out targeted mass testing at areas and estates that were reporting increased number of cases. Kenya Ports Authority in Mombasa, KQ staff who had recently flown, and prisons were key focus areas. But the virus had hit home. Soon, mass testing moved to the estates like Kibera, Eastleigh, Kawangware, Mathare and others in Nairobi. In Mombasa, the spread of the virus was streaming to Old Town, Mvita and Changame constituencies. In the first month of the virus, over 8,000 samples were tested and 208 positive cases realized. With a growing number of cases, the government got a boost in testing capacity, and in the second month ending 13th of May, 27,000 samples had been processed, pushing the caseload to 737. In the third month of the virus, a further 76,000 samples were processed, leading the total infection in Kenya to 3,457. In the 3 months, the daily average has grown from 262 samples to 2,475 now. But the testing strategy is no longer as clear as at the start. The more the health officials test, the more the cases are realized. It's become difficult to trace contacts and inform the next course of action.
So linking somebody with a contact becomes very difficult, and it becomes very, very expensive and tedious and tiring for the healthcare workers. So then you shift your plan from doing contact tracing to basically trying to contain the spread of the infection.
At the start of the pandemic, there were 2 laboratories that could test for the virus, one at Kemri offices in Nairobi and the other at Kenyatta National Hospital. Now there are 28 labs testing for the virus across the country, most of them government facilities. So far, 133,000 samples have been tested, 3.3% of them turning positive. The positive cases now spread across 40 counties, Nairobi bearing the highest burden at more than 2,000 positive cases, while Mombasa follows with more than 1,000. The counties of Busia, Kajiado, Uasin Gishu and Migori appear to be on the rise in the rate of infection, most of the patients being truck drivers who now pose a risk that had not been seen at the start.
The truck drivers who are traversing through the country on our travel corridors, and the concern is that infected persons traveling through the country pose a serious risk of spread of the virus.
Of all positive cases, imported cases are in the minority at just over 8%. The disease now squarely at the community level. Testing for the coronavirus has become a business opportunity for private institutions, some of them charging more than 10,000 shillings for a test. Restaurants and eateries staff have been required to get tested before being allowed to operate. In the midst of business, the Ministry of Health has raised an alarm over unapproved tests that cannot be used to diagnose coronavirus disease.
To use rapid diagnostic tests to claim that they test coronavirus, their test for coronavirus, is incorrect for now, because that's not what is used.
It's been 100 days of testing for the virus. A lot has come to the fore, yet so much remains unknown about the virus. The next 100 days are clouded in the mystery of appropriate strategy, of efforts to establish more testing capacity at the counties, and the challenges of accessing sufficient reagents, a reality that has recently caused a backlog of more than 5,000 samples. Sam Gituku, TV, Nairobi.